Okay, thank you. Thank you very much. Today, it's my pleasure to be here to talk about the contrast ultrasound in pediatrics. As we know, the pediatrics contrast ultrasound is not so familiar in our country. We can do the contrast ultrasound by the intravascular and or non-intravascular. So today I will talk about the three contexts about the application and the security and the message, and then the message how about the intravenous and out of the intravenous. Why we use the contrast ultrasound? We know just talked this morning, Professor Sidhu and Professor Huang to talk about the advantage for the contrast ultrasound in the children. It's real time and accurate evaluation the perfusion and no radiation, and it's more safety than CT scan and angiography. But it's some dilemma in contrast ultrasound in children field. It's about the off-label of use the sonogram, because the sonogram is no recommendation to the doctor to use in the children. Actually, it's off-label user is very common in the pediatric clinical drug use, because about 14% of the drugs is used in children clinical. So we think if the sonogram is not the only one in the 14%. For this now situation in USA, so the drug instruction is recommendation to use in the children, and also the guideline is recommendation. But in European and China, the guideline is recommendation to use your children, but the drug instruction is not recommendation by now. So, by the clinical practice, we have many data to prove the contrast ultrasound in children is very safe, effective, and worthwhile to promoting. The reason is just I talked before is about the application between experience in adults and the application experience in European is good enough. It's no need to use the children to do the experiment and to reduce the unnecessary. So the contrast ultrasound have the same effect on the children. This is Professor Sidhu just talk about the topic this morning. In China, we have many studies about the transvenous contrast ultrasound to diagnose tumor or gastric tract or liver transplantation, and some used in the translumical, for example, the urinary tract or the gastric inflammation, and also use the contrast in the heart for the children with some shunting or deformity. Also, we use the contrast ultrasound interventional treatment to guide the biopsy or biliary tracing. But the situation is that next institute to use the contrast ultrasound is about 13 hospital, and must to obtain the NISCO proof from the hospital for the off-label drug, and must to now the multiple center study about the transvenous or non-transvenous study is underway. And the next, and if use the contrast ultrasound, must to get a special patient's feeding system from the hospital. So I'd like to talk the next topic is the message and application, how to do the transvenous contrast ultrasound. firstly, we just need to know the indication. I think the indication is very similar to the adults, so I don't like to talk too much detail. And so just to tell us, we can use the contrast ultrasound in the newborn baby from his bone. So the contrast agents to injection methods is different from the adult. So the injection method is just about, it's important, is the dosage. The bonus injection is through the computer wing, and the dosage is 0.3 millimeter by every kilogram. So if a children, if children is next 1 year or next 1 year old, 1.3 is enough. 3 to 6 is 3.3 to 0.6 is enough. If the children is 6 year, just 0.3 to 1.2 is enough. If children is 12 years old, maybe 1.2 to 0.4 is enough. So it's very easy to remember 0.3, 0.6, 1.2, and 2.4. It's easy to remember. Now I have a video to show how to do the contrast ultrasound in the pediatric patient. We just to mix the solution as the same way with the adults. Just to injection the saline and have a man fixed in strong hand, and then we use 1 millimeter syringe. Just it's small one, small enough to get the small dosage. 1 millimeter syringe. So we can to do that and to get some drug. So and to, of course, we must prepare the baby. For example, to ask her the history, to read the examination, my laboratory test, and then we start the examination. Firstly, we just to have a scan for whole liver, and then for the whole tumor to find which plan is easy to get the good, nice image, and how to can show the blood supply is very well. So the baby is maybe you can give some drug to make her to have sleep. So we just to decide in the contrast plan, so we can ask the nurse to injection the contrast agent just from here. So we start to injection, and the contrast agent just rush up to the tumor. So you can see the tumor in homogeneous high epiaxial enhancements in here. So maybe we continue to scan the whole tumor, and then to in the same time to observe the baby if it's safe, is any reaction or not. And if the baby is like to cry, you can give him some milk to eat and make him keep silent. So his mother beside, just by my side, he will keep very safety situation. So this is the situation and the contrast. Okay. So I think it's not much different from the adult, but the dosage is the most important things. So when we scan, this step is from 2D to color Doppler to contrast ultrasound, and then we just use the biggest plan of tumor or the most perfusion plan or special anatomy to the observation, the contrast process. And then we gave scan 4 to 6 minutes. From here, we can see from the start to 19 seconds, we can get a continual save for the whole image movie. And then every minute, we save for 10 seconds, 10 seconds, and 10 seconds. Why to do that? We want to keep the bubble in the mouth. If you do not, will maybe rupture the bubble. The image will become very bad. So the imaging is when the interpretation and the measure is very similar to the adult methods. So it's 3-phase or 2-phase or the quantity diagnosis it can do in that. The focal lesion of the liver, just as for example the HCC or the FNH or the focal liver is similar to the adults. Okay. Here is a patient, a 4-year-old male patient. He had a post-operative of HCC. AFP is elevated, so we can see a tumor here. So we give the contrast agents. So have a contrast hyper echo and enhancement, and have watch out in the port wing phase. And here is a baby with FNH. Tumor is here, the nodule is here, have a hyperhomogeneous enhancement, and in the artery phase, and have iso enhancement in the port wing phase. And then is another patient with the hepatoblastoma. So we can tumor is 2D in here, and the color Doppler here, and the contrast ultrasound is some in homogeneous enhancements. So we get the biopsy just to use the contrast ultrasound to guide the biopsy angle. Here is necrosis. Here is some enhancement in here. So we take the biopsy to get the effective tissue. So the diagnosis effective is, this is our data. The diagnosis sensitive is 100%, and the specificity is 94%, and the post predicting is 94%. Is very safety. So it's about the safety. We just read the temperature report. The some side effect is about 0.6 to 0.2% in children. It's a little bit higher than the adults, but it's very safety in our data. And the children's contrast ultrasound have some features, and the image quality has some special. For example, the baby have a tablet faster, and have enhancement faster, and have fade faster. So the first 1 minute is very important for the children, and then some fluid factor for the image quality. For example, the diameter of the vena channel and the injection dose, and the imaging condition. For example, the MI, the prober, and anything else is easy to destroy the microbubble. But by now, existing some problems and prospecting. It's very difficult for some doctors to accepting the contrast ultrasound in the clinical practice, and some complicated parents, and some in the quant of ultrasound machine. So, but in any way, venous contrast ultrasound is helpful to improve the ability and the contrast ultrasound diagnosis. And it's worth to promotion in the children patients. The last, I'd like to talk about the methods and application for transluminal contrast ultrasound. So I talked one disease is about the congenital biliary atresia 先天性胆管扩张胆管闭锁。This is the case and the message how to do to diagnose the bioductal atresia. We use the contrast system and the diluted contrast agent, and then we use the 21 gauge needle to puncture the baby's gallbladder, and then injection some soluble solution, and then to observe the imaging. So it's very interesting. You can see if the baby is normal. You can see here is the gallbladder. Here is the bile duct. It's difficult to see very clearly, but if you injection some dilated soluble to the gallbladder, you can see the bile duct and the intrahepatic duct and some contrast agent to the duodenum. So it's sure this baby is very normal, no any problem for him. So maybe his jaundice is from hepatitis. But if the baby have some biliary atresia, so you can see gallbladder maybe it's not good enough. The shape is not beautiful, and you injection some soluble to the gallbladder. So just the gallbladder is shown in the contrast. You cannot find the bile duct and the duodenum and the intrahepatic duct. So this patient is biliary atresia. So it's very effective way to diagnose the congenital biliary atresia. In brief summary, contrast ultrasound in pediatric is one kind for the pediatric patients, and the masking standardized operation is very important, and it maybe improve our ultrasound diagnosis and treatment in the pediatric disease. Thank you. Okay, I have two questions. Okay, one is how to control the dosage of the contrast ultrasound agents in the pediatrics. So it's if interesting, you can scan the 2D mark and then to get your answer. First is for age, how do you decide your dosage? The baby's age, baby's body weight, the baby's what disease, and the injection place. Injection is in the hand or in the arm or in the intravenous tuber. So it's okay. Okay, because time. Okay, thank you. Okay, thank you. Yeah, B. Yeah, I think B is the most important fact, but the injection place is very important. If injection from the 5 vessel, you should injection a more dosage, a big dosage. If you injection from the intravenous tuber, you can injection just a few dosage. So must to combine some situation. Okay, the second the second question is about how to get the beautiful contrast ultrasound image in the pediatric patients. So one is the instrument adjustment, and B is application for the dosage. C is any image. D is size of the injection needle. So what is about? Okay. So B. Okay. Thank you. The dosage is very important, but I think it's my mistake. I should have D. Actually, A, B, C, D is all important in the clinical situation. Thank you very much.